Today, an estimated 46 million people are without health insurance in the U.S. Gallup finds that low-income Americans are more affected by America's health care crisis. Those making less than $36,000 a year are far more likely to report that they do not have health insurance. They also are less likely to say that they have a personal doctor and that in the next 12 months they'll have access to quality medical care. Dr. Michelle McMurray of the Aspen Institute discusses the risk factors related to low-income uninsured families.
So being poor is a risk factor for disease. You add to that they have less access to fresh fruits and vegetables, to exercise, to gym memberships, to all the things that help you stay healthy, and less information about what it takes to stay healthy, that they're more vulnerable to disease.
Over 40% of Americans making less than $12,000 a year report having health problems that prevent them from doing things people their age can normally do. Those making less than $36,000 a year are also more likely to report that they have diabetes and high blood pressure.
When you think about all the screening tests that if you're lucky enough to be able to have an annual checkup with your family doctor, they do screening tests. They look at your body mass index and say, well, you might be at risk for diabetes, or you might want to change your diet, or oh, your cholesterol is increasing, so you might want to do something to alter the foods you eat to bring down your risk of heart disease. None of those things take place if you don't see a doctor on a regular basis.
Patricia Pirzada and her family have never had health insurance. They're unable to afford it, and they don't qualify for Medicaid. The Pirzadas have learned ways to cope with their lack of regular health care.
Well, the first thing is you try not to get sick. So we do a lot with preventative care. And we do, when we go to Pakistan, go for health care there.
So if you want to just go get a checkup, are you going to go? I mean...
Not really, no. I had my first mammogram in Pakistan last year. I hadn't had a checkup since my kid was born, and she was 16 then. Mm-hmm. And I went to the gynecologist for the first time in years and found that I had fibroids and I had to have a hysterectomy. So fortunately, I just decided to go. I said, well, I'm here, I'm in Pakistan, and I'll go. While I'm here, my husband could pay for it there. I ended up staying an extra month because I had to have major surgery, which we could afford there. Couldn't afford it here. I wouldn't have even gone to be checked up if I was here. For my daughter, that's a different issue. If she needs to go, then we just have to foot the bill out of pocket.
And how much are you paying out of pocket for your daughter?
It's not that bad. Generally, it's about $80 to $100 for a visit. Then you have extra expenses if she needs blood work or something. I remember getting a bill not too long ago for about $400 just for blood work.
Does this stress you out at all that you don't have health care? Do you think about it?
I wouldn't say that it's always on my mind, but I do know that getting sick is not an option. It's because to go to the doctor is just, do you want to go grocery shopping or do you want to go to the doctor? The scary part is that if something happens to her, there's nothing I can do. That's actually the scariest thing, is that if anything happens to either one of my parents, there's nothing to do because, we cannot afford for her to get sick.
Families like the Pirzadas are left with few options for affordable health care in the U.S. But Dr. McMurray says that while improving access to health insurance is crucial, changing our approach to health care by taking preventative measures is also key to bringing down health care costs.
We should be focusing on health span, not lifespan. Instead of focusing on how many days a person lives, we should be focusing on how to make as many of a person's days healthy as possible. And that's the only way we're going to bring health care costs under control.